Thank you so much for being here. We have a 1-hour Ask Me Anything session with 2 of our awesome Aspen Dental Associates and MCDs. I'm going to give you guys an opportunity here to introduce yourself. We still have quite a few folks logging in. So what we're going to do is we're going to pose questions that a lot of our guests have already submitted. We have a huge list of Q&A that has come through. And we actually have an option to submit questions live, guys. So if there's anything that you want to ask, please don't hesitate to click on the little Q&A button at the bottom. That'll prompt me to ask the question live to our guest. So anything you guys want to ask about, life at Aspen, what their experience has been like, please don't hesitate to ask. So we'll get started here. I'm going to have my lovely guests introduce themselves, and then we will jump in on some of these questions. I should probably introduce myself, huh? My name is Rebecca Mazer. I am the Senior Manager for the Academic and Relations team. I work really closely with the talent acquisition team. I have Brian on here as well, who is one of my favorite people on the planet. We work together on helping students get in contact with our doctors, and we host a lot of events and lunch and learns, and we make it possible for you guys to shadow and just get to know us and get to know our doctors, as well as interviewing and all that fun stuff. So we are basically the middleman between you guys and our offices. So we are here to support you and answer all your questions. I'll let Brian, you go first. I'll let you introduce yourself, and then we'll switch over to our doctors, and then we'll get started on some of these questions.
Awesome. I'm Brian. I am a talent acquisition manager, like Becca said. I've been with the company for 9 years now. I primarily actually I live in Lexington. So I know most people on the call, I think, are UK students. So hello, UK. I'm in your backyard. You'll see me downtown probably this coming weekend if you go to Centro. It's my favorite place to go. But I actually cover upstate New York. But I know I'm friends with Ashley Westsane, so I can place you anywhere you want to go in the US. Becca or I both can, so we're both resources for you. And next I'll hand it off to Dr. Sadler.
Hello, I'm Danielle Sadler. Well, I guess not Danielle O'Brien. But I graduated a year ago, and I now work in the Georgetown Aspen office, about like 30 minutes out of Lexington. And I'm the MCD there for the past year.
I am Dr. Turner O'Brien. We both graduated from UK. Go Cats. I am the associate in Danville, Kentucky, and I live in Lexington and love the area.
Love it. And I love your accent, guys. I love the.
That's why she married me.
Yeah.
Yeah, it's a doozy, Dr. O'Brien. Yeah. That's a really good accent.
Yeah.
I love it. Well, thank you guys so much for being with us. Again, this is going to be super informal, very just informative in regards to asking questions about what it's like to be here at Aspen and kind of what brought you guys on board. So we'll get started. So the first question I'm going to pose, and I'll pose this one to Brian, just because I know a lot of our students and a lot of folks have a misconception about what is Aspen and what is a DSO. So Brian, I'll let you answer this one. What is Aspen Dental in regards to a DSO?
So DSO is, of course, a dental support organization. What we do is essentially make sure that when you come in as a dentist, a clinician, we support you in the business aspect so you get to focus on patients and not have to worry about the business side of things. With that said, I'm sure Dr. Turner and Dr. O'Brien and Dr. Sadler, Dr. O'Brien and Dr. O'Brien can attest to, they're recently married. I don't know if everybody on the call knows it, so congrats. But they're able to come in and focus on the patients. They're involved in all decisions when it comes to the individual clinics because they are the leaders of the clinic. But outside of that, Aspen Dental supports you in your career and your ability to see patients and provide them care that they need.
Awesome. So thank you for explaining that, Brian, because the first question that popped up was, do you have any regrets about joining a DSO? Anything you don't like about it. So I'll start with you. I'll start with you, Dr. Sadler. Do you have any regrets about joining Aspen?
I think that Aspen, I mean, we talk about it all the time, and anyone that I've talked to that's a fourth year can say the same thing, but I think that Aspen is the best thing, especially for people coming out of graduating. You know, it may not be something for everyone to stay in forever, but it is the best thing to learn, and I think that a lot of people find a good place to stay there forever. Obviously, me being in the MCD role, I feel like I've learned a lot from my doctor that's teaching me now, and there's a lot of room for growth in many offices. So I think, no, I don't have any regrets, but I think it's been a really, to compare to the things that I've seen in other places outside of this, granted, you know, everyone has their own thing, but I feel like we've learned more than I ever expected to learn in year one. But two, like you kind of said, Brian, I don't have to worry about the business stuff, but I have learned a lot of business stuff. Whenever I have questions, you know, I have a regional manager, I have my office manager, and all those people that can answer those questions for me, but I don't have to like come home every night and worry about that. So
Awesome. A really quick follow-up, Dr. Sadler, did you interview with anyone else before you joined Aspen? Or, I mean, did you interview with private practice or with anybody else?
we did. We had a confusing life situation, but we started with interviewing for Aspen. We interviewed for private practice, and obviously up in Indy, we weren't sure where we were going to live. So my dad being with us up in Indy, we did interview in other places. I think it's hard. I just didn't feel it.
We interviewed with a couple offices in Indiana, a couple private practices in Lexington, and we actually talked to a couple other DSO organizations as well around the area.
Yeah.
Cincinnati
And
area. And
So what made you choose Aspen out of everyone you interviewed with?
probably Brian. Brian might be the one. Well, first off, we had some weird interviews with some DSOs that I didn't feel like I was going to get the support that I needed there. And not only clinically, but also just the background of the business. I wasn't sure how that was being run. I feel like Aspen, Brian specifically, is very transparent, and I was a little nervous you're nervous going into the job, but you're nervous going into it not knowing what's going to happen, and they tell me everything, but when I got into it, I felt very confident that I knew everything that was happening before I got into it. So I felt like I already kind of felt that before we got offered the job, but it was just a feeling. That's not really probably an answer.
It felt very organized, and we liked
organized.
that.
That's good.
You know, any question we asked was answered promptly. Like she said, it was very transparent, and you know, we just could feel that support system was going to be there. Whereas some of these other, you know, places, it felt more like an interview and less like, you know, a team that wanted you on their side.
I feel like to compare it to some private practices, like he was saying, a lot less like questions weren't just answered like this is this, where you're like, oh, that seems like we don't know yet. But Aspen knows what they're doing, and they've done it a million times. So it's easier for you guys to answer those questions, I guess. So.
Love it. Awesome. All right. So we have another question that populated here. Name a few things that you really enjoy about working for Aspen and a few things that you don't. Now, obviously, we want you guys to be honest. So name a few things that you really do enjoy about, you know, your current career with Aspen. And then if there are a few things that you wish you could possibly change, you can name those too. I'll let you go first, Dr. O'Brien.
Yeah, one of the main things I love about working at Aspen is, you know, I'm the associate in Danville, Kentucky. I work with another great doctor, the MCD there, but I have complete control of my treatment plans, complete autonomy of everything that I do. You know, of course, we jump back and forth between, you know, patients that the other one sees occasionally, but most of the time you know, our office managers, our assistant office managers do a great job of lining up our schedules with the new patients that we see. so that we can, stick with the patients that, that we've seen and complete that treatment throughout the process. But we just have a lot of support, a lot of office support, in general. Like we were saying earlier, we don't have to take work home with us. Of course, we think about patients and things like that, but we don't have to take the business side home with us. But we do get to learn a lot about the business side. But as a new grad, it's great to get to come out and just focus on dentistry, because you learn all the hand skills you need to know in dental school. But it's a whole different world out there once you get into real world dentistry, going from seeing 2 or 3 patients today to seeing 20 to 30 patients a day. And we just have really good support from the management side and from the owner doctor and my MCD side as well. So I just really enjoy having autonomy over my my patients, and it feels very much like a private practice to me, and that's team by team, honestly. But our team's great, and I know Danielle's got a good team as well. Things I don't like, I mean, any job that you have, I've had a lot of people I graduated with that have moved jobs, have changed jobs. So it's hard for me, with the support I have at Aspen to, say, a lot of things that I don't like about it. I will say it's extremely fast paced. You're going to be running around. If you want to just, sit half the day, then Aspen's probably not for you, but that's not the type of dentist I am, that I want to be. I enjoy running around. I enjoy staying busy. We work a lot, and it goes by very quickly because we are seeing so many patients and seeing so many different cases that I feel like I've learned so much in a year. And, it's one of those pros and cons thing that if you don't want to be working the whole time, then you might want to try someplace else. But I really enjoy being busy most of the time and spending most of my time with patients.
Awesome.
Which I'll kind of tag off of that. I think without learning the amount that we have, I mean, Aspen got us Invisalign trained immediately. I think that was a big thing, that they want you, or you guys want us to learn as much as we can, and we don't have to seek that stuff, where you guys it just happens. And obviously our CE is just always kept up with. We did a million CE during COVID and all of that, which was awesome. With one of my favorite things with Aspen is actually surgery. I love the amount of surgery I get to do. I don't think there's some places that actually refer, that are general dentists, that refer to us, who is also a general dentist, but the amount of surgery we get to do, which I know for some of you all new grads, that might seem a little bit scary or intimidating, but you pick it up so quickly, and it's one of my favorite things, where a lot of other places don't provide that, and you don't have the denture aspect. Aspen is obviously very denture heavy, so also for people graduating, you're not doing a lot of the denture stuff that you hate. You just need to do
way different. We were scared too coming in, but we do the fun part.
Yeah, we do all the fun stuff, and I love that part. Kind of what he was saying, I think you are busy. With me being the only doctor in the office, I'm running around with my head cut off sometimes, or at least I feel that way. But I wouldn't trade it for anything, because I think I've learned more than anyone could in a position that's at a place that's not running as quickly, or not seeing them a number of patients. Obviously, the more patients you see, the more you're learning. So I guess it's a con, but in my opinion, it's really not in the long run. So.
Right. And I really appreciate that you said, this fast-paced environment's not for everyone, right? And that's why when we are, talking to students and talking to candidates, we're very transparent when we say you're going to be busy and you're going to see a lot of patients. And if that's something that you want, and that's something that you're interested in, and you want to learn and be hands-on, then this is a great opportunity for you. But there are some folks that would rather be a little bit on the chill side and not see as many patients. And that's when you say this might not be the right fit for you, because we're busy. But busy is good because we have a lot of business, right? So that's awesome. So we do have a question that just popped up live. So it said, what was the recruiting process like? And was it fairly easy to talk about looking for a job with Aspen? And what did your timeline look like? So I'm assuming for maybe when you're a D4, what was your timeline like? What was the recruiting process for you guys? When did you start interviewing? And what did that look like?
So one, it started probably at Keeneland with Brian. That's where like the first recruitment probably started.
Now, was that fall Keeneland or spring? Because we usually do two, right? Maybe October?
Probably.
I think it was the one that
we
Aspen
probably saw
throws
you
on,
third
so.
year. Honestly, we probably came to a third year thing and met.
Yeah.
You. But
Yeah.
fourth year, it had been.
So probably October, because that's,
Yeah.
I want to say that's kind of when the D4s start really piquing their interest is in October.
Yeah.
It was because
then we
originally had talked about going back to Eastern Kentucky, where I am from, with Aspen.
Yeah.
But then, we decided we had to stay in Lexington. So, we reached out to Aspen, which was also another extremely grateful and helpful process that we went through, because, originally they didn't have any spots around Lexington when we would reach out to them, job openings, things like that. And then so we called them and we're like, we can't live in Ashland anymore. We can't live in Eastern Kentucky. And we were, just a little nervous, honestly, had accepted a job in Ashland, and, we loved Aspen and we wanted to stay with them because the recruiting process had been so great and, so prompt. And we reached out to, Maggie, which is our director of our territory, and told her, kind of the situation. And she was, excited to tell us about these new job opportunities that we had, around the area of Lexington. And, they fought hard and found us jobs within, no time. We met with the owner doctors. Dr. Young he's a partner with Dr. Enan, who owns a lot of the offices in Lexington. But Dr. Young and Dr. Feltner are our, partner owner doctors for our offices, and we interviewed with them, and then within a week, we basically had job offers, and it was easy.
That meeting was probably in like January.
Yeah, that sounds about right.
And then around February, we were signed.
It was
signed, sealed, delivered.
It was quick and organized and easy.
Yeah, it was very easy.
Awesome.
And made our lives much better.
And
Absolutely.
I met with you guys whenever you met Dr. Young and Dr. Feltner, wasn't I? Yeah, okay. Yeah, I feel like I remember that.
That's a great story, guys, because like you said, you were originally interested in Ashland, and then life happens and you had to actually stay somewhere else. So the fact that, we work with you and kind of figure out where we can place you and, find you a job and a position in a different place. That's the great thing about Aspen, is that we have tons of opportunities and we have tons of locations. So if you have to move or if something happens, then we can look for you. So that's, I'm glad that you guys were able to stay with us. Super awesome.
They treated us as part of the team, and we hadn't worked a single day for them.
Yeah.
I love it. That's awesome. All right. So, that was a great question, because for you D4s that are on, you guys life's happening fast, right? COVID's shifted a lot of the way things are happening at school. But typically we start interviewing you guys, I would say September, October. I think we've already signed a few D4s.
We signed our first D4 this year, July 20-something. Yeah. So we've already started actively. I know last week we hired 2 D4s for 2021 grads. So it's not too late to start now.
2021 grads, guys, it's not too late to, at least start having those conversations and interviewing, because if you wait until January, February, March, a lot of the locations that you're interested in are going to be taken. Some folks do not waste time. So if you have any questions, definitely don't hesitate to ask. All right, so we'll keep going because we have quite a few questions that have popped up, and I want to get through as many as I can. So Dr. Turner, you are an associate.
Yes, ma'am.
And then Dr. Sadler, you are an MCD. Can you quickly explain what an MCD is?
So it's the main clinical doctor. So the MCD What is it?
Managing clinical.
We don't know.
There's a lot. There's a lot of.
I just say
We have a
acronyms.
lot. We have a lot of acronyms. A lot of acronyms. One of the questions that popped up is asking about the lead dentist position. So before I jump into that, I want to make sure that when we say MCD, it's managing clinical director. It's basically the lead, right? It's the lead dentist in the office. And Dr. Sadler, you're currently the lead dentist in your office.
Yes, and I don't know what MCD stands for, but
It's not important.
Managing clinical director,
yes. So
which translates to lead.
lead
Yeah.
doctor.
Yeah.
Which actually for my office is a little bit different, just because I'm the only doctor. Everyone else in our region, the MCD is like the lead doctor, and then they have the associate. But I was thrown into the position, which was such a blessing. I have like he was saying, Dr. Young is my partner owner doctor. So he comes in, he's actually in the office today. So when I was onboarding, I spent a month with him, but then he would come in every like 2 weeks or something. And he still comes in and we kind of chat and go over stuff. So I don't feel alone. I'm just, it's a lot for one doctor sometimes, but I think the main thing is just, I don't know,
Especially coming straight out of school.
yeah, I don't even know what my job is. I guess I'm just I guess it's probably a better question for him, because most of the things differ with an associate there, where I don't have an
Absolutely.
associate.
Right. So let me ask you this question then, because the question that populated was, if I start as an associate with Aspen, how quickly can I become a managing clinical director / lead dentist at Aspen? So for someone that comes as an associate, how quick is that progression?
I think it can be as quick as possible. I mean, obviously, just the example of me being brought into that position, I think the position has to be available. But at the same time, just showing your production and just like any other job. I mean, I'd say as quickly as the job is available and how you've shown yourself.
Absolutely. Brian, do you want to answer that?
Yeah, so a lot of times the progression from associate to a lead dentist, one, availability of position, of course, and then also it's a combination of how you practice clinically, whether or not you're clinically sound, essentially, and that's up to an owner to decide, or a partner in their cases. Also, leadership ability, that's the biggest thing. So as an associate and as a lead dentist, you're leaders in the clinic, but the main person driving it, of course, is the lead dentist. So making sure that your leadership skills are there and you're coaching and developing your teams. Whenever you get to the point where you're at that spot and a position comes available, you're usually the first one queued up to go there, as long as you're willing to go to that location. So that's the biggest thing, is like leadership and ability and experience. Not necessarily all the time, because Dr. Sadler was a new grad coming out, going straight to the lead dentist position. I think you having your experience as a DA with your dad and working with your dad sort of gave you this leg up to have that position over Dr. O'Brien, no offense. I can't speak for Dr. Ener and Dr. Young in their decision making, but I think that's sort of where their heads were at the time.
Awesome. So, I mean, absolutely. There's tons of opportunity for growth with Aspen. So you have the opportunity to come in as an associate, then you can move into a lead role, and then we have ownership opportunity, which it's huge. And a lot of folks don't understand that with Aspen, all of our offices are individually owned by our practitioners, and Aspen Dental Management is who I work for, is who Brian works for. We are the support system, and that's where the dental service organization DSO comes from. Is we support we support our docs, we support the owners, and we kind of do all the back office business stuff. So I'm glad that you're able to answer that. We have another question that popped up live. It's asking, is there any part-time positions with Aspen? Brian, Howard, do you want to answer that? Part-time?
Yeah. So of course, all of our openings that we have and all the doctors we bring on are you're hired by a doctor. It's up to them and that office specifically. Some offices have too many patients for one doctor, but not enough for two full-time. So at that point, you can come on part-time. We have some doctors that work 1 day a week, and we have some that are strictly PRN, and we just call them when we need them. So there's all different scopes of availability that we take. And I just got a text from Maggie, who's also on the call. She said, I'll take them all in Kentucky. So we'll work with you as long as you want to work with us. Sometimes flexibility on both ends has to be there, but ultimately, long or short way to answer my long answer is yes, we do.
Yes. Yep. So, I mean, Maggie, love you. I know you're creeping on here. So there are mentors that are that are interested in some opportunities. We have an abundance of them, and you know, if part-time is what you're looking for, I mean, we'll make it work if that's something that the owner is, you know, has an opportunity for. So we'll make it work, right? Okay, so we have quite a few questions, guys. This next one I populated was, what type of patients does Aspen typically see in their practice, and do you guys accept Medicaid? One of you guys can answer that one, whoever wants to take it.
We do not accept Medicaid, which is a blessing, honestly. I mean, one of those people and everything. It's just we see too many patients, and we have too many people that, you know, have, you know, pay out of pocket or, you know, have other insurances to take Medicaid, basically, is what it comes down to. Our demand is too high. What was the other question?
Type of patients that we see.
Oh, type of patients that we see. So we see a lot of blue collar patients, I would say, in Kentucky. We definitely see a lot of denture patients, do a lot of surgery. We do plenty of crown and bridge. Both of our partner doctors come to our office once a month to place implants. We do implant crowns. We do, one of my favorite things about Aspen, me and Danielle talk about all the time, is the type of dentistry that we get to do, because we do everything. We do everything, all restorative. We do all, you know, surgery. I do, you know, we both do Tora. I do fully bony impacts all the time. You know, I was, you know, lucky to have, you know, my lead dentist, you know, started doing it, and he just kind of walked me through it, and, you know, I watched him a couple times, and then just started doing it on my own. We do tori removals, we do exostosis removals. I mean, basically, we don't refer a whole lot to oral surgery, you know, outside of, you know, medically compromised patients or, you know, certain wisdom teeth, things like that. But we do the whole scope of dentistry, and, you know, people think of Aspen and dentures together. The denture process, we have a lab tech in-house. It's extremely easy. We get to do the art part. I mean, we get to do the wax tries. We get to, you know, make sure that the patient likes their teeth. We don't, you know, do wax rims. We're not setting teeth. We're not doing these things that you do in dental school that's so miserable for dentures. But we see, I would say, middle-class, blue-collar patients mostly. And they're great people. They really are. I think that's about the best type of patients you can see, in my opinion. They're not too picky, but, you know, they like to be, you know, satisfied and treated with respect.
I love that. I love that. All right, guys. So another question that just popped up was, how long did it take for you to transition up to speed once you started working after dental school?
I mean, honestly, I think this is one of those things that you have to have that personality. For Aspen is, you know, for me, well, both of us spent a month training. So you're not thrown into it right away. You kind of pick up the flow. Depending on who your doctor is that you're shadowing, he would kind of throw me in, and I would do a day or whatever it is. So you spend that whole month not only learning the process of just being in an Aspen office, but also the speed and, you know, how you jump from your new patients to your denture, just kind of the flow. They might be talking about clinical speed. I think it's just, I get faster every day that happens. So
I'll say it took me a full 6 months, honestly, to get where I felt like I was very comfortable and supportive for the office and for my lead dentist in order to, you know, treat the patients the way that I wanted to treat them and really get comfortable with the pace. The pace is everything. I mean, like I said, you come out of school with hand skills, but until you have, you know, 3 notes in your hand and, you know, you're ready to switch back and forth between patients, you know, that takes a minute to get used to. But I mean, I can tell you just based on, you know, other classmates we've talked to, we have learned, you know, through the roof, you know, more than, you know, a lot of our other classmates that we know, just because volume alone.
Now, in regards to speed, guys, are you given a certain amount of time with patients? Do you just kind of set your own time? What does that look like?
So when you start off that month that you have, you fill out like a sheet and it says like if you're to do 1 filling or 2 fillings or 1 extraction or full mouth extraction or root canal, and you fill out your time card. And then I think Brooke, or regional manager, like every 3 months or whatever, she'd be like, hey, like, do you feel like you need more time or less time with that given, you know, where you're at now? Which, you know.
And we can talk to our office managers. I mean, day by day,
Yeah.
we can talk to our office managers. I'll just walk up with a treatment plan and be like, just give me, 2 hours for this one, or, they do a great job most of the time knowing how long it takes, and they know how long it takes us. And, when we're getting faster and things like this, but, case by case, if we have special requests, you can make that, on the spot, but we do have, doctor preferences. We get to choose how long, we need for specific patients.
Awesome. So it just sounds like it's just open communication between you and your office staff.
Yeah.
Okay, cool. We have a question that just popped up. It's asking, is there the opportunity to grow in the area of injectables and fillers within Aspen? Have you guys had that conversation at all?
So I had talked to Dr. Young, my owner doctor, about it a while ago. There are, yes. They don't know about basically how much money it brings in. So he
Okay.
was, one, you have to be certified, which to whoever's asking, I don't think you would have a problem doing that. Because once again, Aspen, if you know that it's gonna benefit you and Aspen, they'll make it happen, basically. So I think there's definitely, especially for denture patients, that was one thing, is I was talking to denture patients about Botox, which sounds crazy, but they're a big part of our population. So I think, yes, you can. I think you could, but they don't know about how much production it's going to bring yet for us to do all of that.
Actually,
I was going
Maggie,
to say, Brian, do you have an insight?
yeah, so Maggie actually just texted me, and just today they announced that we're doing a test. So we're actually collecting names of doctors who would be interested. So we're going to test it to see how it works out, to see what patients think about it and how it works with their business model and things like that. So Dr. Helford, who is our clinical director, who's our clinical directors are doctors that have worked with us that now support locally practicing doctors. They travel around, they don't practice clinically, but they coach and develop and things like that. So he's in charge of our area, and he said that they're actually working on a test to see about it. So Dr. Sadler, you might want to reach out to Maggie and throw your name in the hat for that.
Maggie, this is me reaching out to you.
She gave me a thumbs up. So
I was on a call yesterday and with Maggie, and I didn't want to say, because we were told to keep our mouths shut until they made the announcement. Do I ask this question live? But yes, I mean, the opportunities there for Botox and fillers, it's going to be an awesome initiative. They're going to start offering the certification. They're, like you said, they're going to look to see production-wise how it's, if the office does offer it, what it looks like. But yes, Aspen's going to start offering that, and we're going to start allowing the dentists to get certified and start doing it, which is really, really cool. I'll be a guinea pig.
right here, all of this. I don't need this to move. All this to fix it.
I love it. So yes, guys, very exciting. And another kind of a question that popped up while we were talking about that is, do we offer the opportunity to do implants? I think those are all great questions, because you recently just answered one about Invisalign, right? These initiatives come out and then they offer it out to you guys. So are any of you two doing implants now?
You're not, but both of our owner doctors do, and I feel like that would be something that if we wanted, which we do want to, I think we kind of just wanted to get everything under our feet.
Walk before we run.
Yeah.
Right.
But I know that both of our owner doctors did like I think it was in Colorado, or no, they went somewhere else.
They went 2 separate places, but our owner doctors are friends.
Yeah, but they did an implant course that they've talked about at some point us doing. I don't know when that is, but
yeah,
September 18th. You guys are getting implant trained starting September 18th.
September 18th.
Is that placement as well?
Well, I'm waiting for the text from Maggie because she's listening and filling me up. She hasn't sent it to me yet, but yes, you are.
So the great thing is that there's tons of opportunity for growth and for learning. And like you said, it wasn't something that you were ready to take on, right? But now you know that it is definitely an opportunity. And tons of CE courses, certification courses available out there. So for whoever did ask about implants, yes. We typically have the owner doc get certified, and then it kind of trickles down to MCD and to associates. So the opportunity is there. And hopefully you guys will start doing those too. So another question just popped up, which is a little, it's a little aggressive. So I'm going to have Brian answer it the best way possible. In a bad way. But apparently this person's ready to rock and roll. The question is, how much money are you making a month on average? Thank you, and go Cats. So clear.
Yeah. Go Cats, C-A-T-S.
Go Cats.
Maggie did say,
I was gonna say, if you want to answer that, Brian, kind of talk about, you know, what an associate pay would look like, or an MCD pay would look like. Because obviously we're not going to say, hey docs, how much are you paying? How much are you getting paid? And
what was your P&L this month?
Next time.
Yeah. So to follow up on the implant question, Maggie did respond. You will be,
awesome.
It's online virtual training to sync single placement implants. So yay, you'll be starting doing that September 18th.
Love it.
So all the new guys on there, that is an initiative that we rolled out. We actually hired an implant specific, or a doctor specifically for implant part. And so it's a progressive training from single placement all the way up to all-in-4s eventually. So it's a comprehensive treatment training over a course of a period of time. I don't know exactly what that looks like. I know they're still trying to iron out things, but it looks like they've gotten at least phase 1 started. So that's really exciting. As far as compensation, so we compensate our doctors pretty much all the same. It's up to each individual owner, but 99.9% of them go by what we recommend, and the reason we do it that way is it's beneficial for all parties involved, right? So you get paid a guaranteed daily, and that daily does not change no matter if you work 5 hours, 10 hours, what have you. No matter how many patients you see, whether it be 1 or 20, you get the same paid daily rate. From there, each individual doctor gets paid a percentage of profit for the clinic that you work in. That percentage varies on position, but essentially it's a floating scale that's based on patient satisfaction. So the higher your patient satisfaction, the more profit that you would get. Now what's great about that is not what you do with your own individual 2 hands, it's what the entire clinic does. So for Dr. O'Brien, it's not only what he brings, what he profits for the clinic, it's what his lead profits. It's what his hygienist profits. If an oral surgeon or endodontist come into the clinic, it's what they profit as well. Even his owner doctor that comes in, when he comes in and syncs implants, Dr. O'Brien's making money off of that. Same with Dr. Sadler. She doesn't have an associate, but what she does, her hygienist, oral surgeon, endodontist, or owner, when they come in and sync implants, they're making money off of that. The percentages vary. And the daily rates vary depending on location. So your recruiter, Becca, myself, whomever, can talk to you about what those specifics are for the location that you'll go into. Is that accurate, guys? Do you guys feel like I described that correctly?
Accurate. I mean, I'm sure, I know as a 4th year, I would have known, I would have wanted to know a number. Our base salary is $10,000 a month.
Okay. I didn't want to say it out loud, unless you guys approved it.
That's right, $10,000 a month. And
I should go to dental school.
Annual bonuses almost every month somehow. No, but
So,
I paid the money up here.
yeah, she's the breadwinner over here.
With that said, oh, sorry.
So Dr. O'Brien, you are a kept man.
I am, yeah. I'm well, 4 or 5 months out of, I've been working for like 11, so.
Which I want to just point out, Brian, because I feel like other people that are looking for jobs don't think about this, is that the daily rate that is set is huge.
Oh, yeah.
Like, I don't know of another place that does that, especially in dentistry, obviously, but I'm at DSOs. But having that, even when granted, I've never shut up and not a patient be there, but if that were to be the case, you still get paid your daily rate, which is incredible.
Which a lot of private practices, you're getting paid off of
just production
or collections, mostly just collections more than production. And you might have one day where you make $900, but you might have 3 other days where you make $100 and $200. And we make $500 a day no matter what, plus bonuses. So
now on top of that, what I was going to say too is, so just to give you a general salary expectation. So we have 823 offices between the entire Aspen network. So take this with a grain of salt, depending on the location that you're going to, because some offices are more profitable than others. But our average associate, and this is based off of 2019, average associate made about 145 to 150 a year. And our average lead dentist, we made between 230 and 235. So it gives you a reference about where you land after your daily rate, which pretty much all doctors are about the same daily rate. It's your percentage that makes the difference of the clinic profit.
Love it. So you have an opportunity to do very, very well.
Yeah.
Like you guys said, that daily guarantee doesn't go away, which is really important, because I worked for another DSO and you got paid a daily guarantee, but you only got paid the daily guarantee for the first 6 months. And then you switched strictly to production, but it was only 30% of your production. So it got really, really sticky, right? So the fact that we offer that daily guarantee, it's awesome, because it's basically what you can bank on, and then everything else is an incentive and an opportunity for you guys to do more and to do better. So that's awesome. There's a lot of room to make really good money, which is exciting. Okay, so we have a couple other questions, guys. We have about 15 more minutes. I'm going to try to get through as many as I can. And then we've got a couple live questions that popped up as well. So let me go through a few that were submitted, and then we'll answer some of these live ones. Let's see here. Which one do I want to ask? Okay, so what kind of cases are you guys working on now? Anything in particular? Do you guys see some cases more than others?
I mean, just a couple cool cases that, that I've been working on kind of recently. Some anterior crown bridge cases. I've done 2 recently that they're missing their laterals, or, we pulled their laterals because they were of decay, or they were root canal and broken, things like that. And doing, bridges from 6 to 8 and from 9 to 11. So, those are pretty cool restorative aesthetic cases. I actually just treatment planned a guy the other day. Just no decay on his front 6 teeth, anterior maxillary 6. But he wants them to look better. They're a little crooked, things like that. And we're doing, anterior 6 crowns on them, just aesthetic. Another thing I did today, did a full mouth surgery on a patient who had 2 implants that, all the teeth around them had failed. So kept the implants in there to hold the bone, but took the implant crowns off, placed healing attachments, pulled all the rest of the teeth, and placed upper and lower denture. So those are just, couple cases that I've done in the past month to 2 months.
Okay, so a little bit of everything, which it sounds like you guys have. And I know you guys mentioned this before, and I just kind of want to reiterate this because there's a question that popped up and it said, Aspen's known as a denture mill. Do you guys only do dentures all day long? So that's a question that we get a lot, right? Because we do offer a lot of dentures. But like you guys mentioned, we have a denture lab that makes a huge difference. On average, when you were in school, how long would it take to turn a denture around?
Yeah.
How long?
4 years?
No. I mean, a whole semester.
Yeah.
Seriously? A whole semester.
I can tell a patient who has all of their teeth and needs them all pulled that I can have them in dentures in 2 weeks easily.
Okay.
Sometimes even sooner, but I feel confident that my lab tech, we can do the impression, the bite, or the wax. I guess we won't have to wax dry, but you know what I'm saying. Everything's pretty quick.
Another thing we haven't talked about at all that I do want to mention is we have iTero scanners in all of our offices. I haven't taken a PVS crown impression since dental school. I scan every crown impression, subgingival, supergingival, it doesn't matter. I haven't packed cord a day since dental school.
That's awesome.
Yeah, and also for immediate dentures, so we do immediate dentures where you pull the teeth and place them immediately. We a lot of times will just scan their arches, upper and lower, and then send them off to a lab, and we get them back in like 2 weeks and do their surgery.
That's awesome.
Get dentures.
So you went from having a few months turnover with your dentures at school, or a year, I don't know, a full semester, to 2 weeks on average. Yeah. Awesome.
And
Brian,
that turnaround time should probably actually improve, because I know we're also testing right now to make sure we get the technology right, to make sure it doesn't inhibit our doctors at all, but digital dentures in total. So no alginate impressions or ASAPs or anything. It'd be just scanning.
I love it. I love it. Okay. A couple more questions, guys. One that just came in was, how many hours are available to work each week, and how does vacation work? Brian, do you want to answer those? Hours
Yes.
and vacation time?
So I can talk about our, I say typical office hours. Your owner doctors, the doctors that work in the clinics, Dr. Turner, Dr. Sadler, Dr. O'Brien. I keep on calling you Dr. Turner for some reason. Dr. O'Brien, Dr. Sadler, and as well as the business partners all get together and they decide the best hours for the clinic based on patient need, as well as doctor need, essentially, and staff need as well, because we're all a family, we're all a team, we got to work together, but we also make sure that we're there for the patients. Our typical office hours, however, are Monday, Tuesday, Wednesday from 8 to 6 with an hour lunch break, 10 to 8 on Thursdays with an hour lunch break, and then 8 to 1 on Fridays. So it's a half day. There's no lunch break, but it's only 5 hours. And then if we do open a Saturday, which we try to open at least once a month to have access for care for patients, we open 8 to 3 with our 30-minute lunch break. Also on those Saturdays are typically skeleton crews. So you're seeing your procedure patients and then new patients. We try not to weed in anything else that's sort of filler appointments, if you will.
Love it. And then did you answer the vacation question? What is vacation?
Oh, no, thank you. So our typical vacation is 10 days, your first 5 years. Well, your first year, you get 10 days. Your second full year, you'll get 13 days. At 5 years, you get another week. And then at 10 years, you get a fourth week.
To clarify, that's paid vacation.
Paid vacation.
That's paid. You get paid your daily rate on
I
your
don't want them
vacation.
to be confused here, Brett.
Yeah. And so what's
Thank you. Thank you for answering that.
what's great for a situation,
We appreciate you.
what's great in both their situations actually is, so when they do go on vacation, they're going to get their daily rate while they're gone. But also keep in mind, we typically have the other doctor or the owner doctor come in and take care of their patients while they're there. So they're still supported, and they're not like this lull in revenue or any kind of production while they're gone. It's still maintained while they're gone. So we have that support system from a clinical side as well.
Love it. So we have another question that just popped up about implants. So this gentleman said, I'm currently doing a GPR and I'm very comfortable placing implants. Do I get to place implants at Aspen right when I start, or do I need to take the CE courses first? Brian, do you want to answer that?
Yeah, so that'll be up to you and the owner doctor, ultimately. The 4 weeks, the first month that they were referring to earlier in the conversation, it's called the Doctor Mentor Program. And that's also not only a time for you to get comfortable with their systems or processes or flow, but it's also a time for your owner doctor to really gauge where your skill level is and where we need to add in education and CE for you to improve your skills. So that's the conversation you have during the interview, honestly, but also, during that mentorship program to say, hey, when do you think I'll be there? I want to work toward that. That's my ultimate goal. We can set a plan in place for you. And that's something for the director like Maggie to do, also the owner doctor, for them to have those steps in place for you.
Awesome. Okay, so quite a few questions that we still have, guys. I'm going to try to get through as many as we can. As you can see, I'm blind because there's so many. Okay, so this question is asking about specialty. What kind of specialty do we offer, and what do we refer out? Do you guys offer any specialty in your offices now?
We had an oral surgeon and an endodontist that came in. Our endodontist actually moved, but we now are having an endodontist that is roaming around our offices.
Yeah, he kind of travels between the Central Kentucky offices.
But to answer that, you can pretty much refer or do whatever you feel comfortable with. I refer molar endo, and I only do anterior endo.
Yeah, all the doctors I know only do premolar forward.
Yeah.
If you like doing molar, go for it. I thought I might try it out of school, but it's not for me.
We do have an oral surgeon. That's mainly we did. No, we don't.
We don't have
But,
one. I think.
Yeah, we are in the process. Maggie will probably text Brian here.
Yeah.
But
I'm waiting for it to pop down.
Yeah. But you can refer to anyone, in the surrounding areas if you don't feel comfortable doing it.
Yeah.
Love it. So I guess the key takeaway there is do what you feel comfortable doing. And if you don't feel comfortable, then you can refer that out.
Exactly.
Love it. Okay, one other question. This is not Aspen related, but if you were to go back in time, what would you tell your dental school self? How did you make it through the years?
That's a good one.
Question. I love that.
Because this beautiful girl right over here is not.
Yeah, if you haven't found yourself a husband in dental school, you should.
Show us your left hand.
Yeah.
Working on it. I don't know. I mean, I honestly really enjoyed dental school, so there's nothing I would have done differently.
I would say to enjoy it as much as you can. I know we had as much fun as we possibly could, and we both finished in the top half of the class. And I can promise you that there are people that, you know, just didn't manage their time as well, that got worse grades than us. We went out on the weekends sometimes. We went to the Keeneland events when we might have a test on Monday. But,
I know that,
But that's how we got our jobs. So it's fine.
Yeah, that's how we got our jobs. We were social in dental school, and I think it's important to, not overload yourself with class all the time. I think you need to have some fun too. Focus when you got to focus. That's definitely important. Learn the things you got to learn, but have some fun while you're there.
I was going to say I didn't go to dental school, but come to all the Aspen events because me and Becca can rage with the best of them.
Definitely go to all the Aspen events.
Oh, yeah.
Do not
Good time.
I don't care if you have a test. I don't know what exam is hard. Any exam. Gross anatomy.
We never miss.
And here we are.
I love that.
We're not, geniuses or anything. So.
Sorry guys, I'm typing up a response to someone really quick, but I really love that. And I like that you said, take the time to go out to events, whether it's Aspen, obviously come to all of our events, duh. But go out and go to all the events, right? Because you want to get to know the different DSOs or different people that, I'm not sure private practices really host events and socials, but I know other DSOs do. But go out there and get to know them, ask questions, meet doctors and network, because that's how you guys found a job, right? It was meeting Brian, meeting me, going out to events, and then meeting Maggie, meeting doctors, and kind of really, hanging out with us and then seeing what our culture was like. And I think that's kind of what sold you guys and why you joined. So I think that's really important. Obviously focus on school, but also take some time and have fun. And obviously you guys got to meet each other and now you're married and here we are.
Actually, I think I met you guys at Mr. Moeller the first time. I've been trying to rack my brain about the first time, and I think it was Mr. Moeller.
Was that the one that I compete that year?
No, I couldn't make it to the firefighter one. I couldn't make it to.
You missed out, Brian.
First and foremost.
I've heard. I've seen pictures.
I'll send you a video later.
Oh yeah, please do.
Make sure you add me to that as well.
Okay.
I love that. All right, guys, we have a couple more questions. Let's see, which one do I want to ask? Because there's a few. Okay, this is a good one. Do you have a quota? We get asked that a lot.
No. There's really nothing that, there's a budget, but that is actually nothing.
Has nothing to do with us.
Yeah, we aren't told how many crowns to do or how many dentures, but what is nice is that, especially being a new doctor, there is a percentage of just throughout America, like how many people need a crown. So a lot of times our regional manager will come in and be like, hey, like, by the way, you are right on track with the number of crowns that most people are doing. Like you're seem to be treatment planning fine. It's not like she's telling me like, oh, treatment plan more or less. It's just more to like give us an idea, especially being a new doctor. It's helpful for me to be like, oh, I'm on track of what normal people need, I guess, but no quota, no.
Yeah, there are a lot of numbers behind the scenes that, the managers, the ops managers, the regional managers, they deal with within the office, but it has, nothing to do with the doctors. Like I said, we do all our own treatment planning and treatment plan whatever we want and aren't pushed to do anything. We have such volume that it really isn't an issue mostly.
Awesome. I mean, I'm glad that you said about volume because another question that just popped up was, how many new patients do you see per day? I know you guys are both busy. How many new patients do you see and then how many patients on average?
I think my new patient right now is like 5. It might be a little bit more, like 6 now that COVID, because since COVID it's been a little higher. His is probably his average is probably a lot higher, but I see about 5 or 6
Ours
on
is
average.
probably 8. I'm sure Maggie can pop down and give
Yeah,
you
I was
the
gonna
exact
say,
number.
Maggie,
I'm waiting for the pop down right now.
5 to
There's
6.
some days you'll have 4, and I've been there by myself, and Danielle I know has too. I've seen like 14 new patients by myself, which is a crazy day. But you know,
How many patients on average are you guys seeing per day?
if you count production plus new patients plus like periodic exams with hygiene plus denture steps, 30.
Say 30.
I would say 30 to 40.
Maggie
Which
said
sounds,
25.
What?
7, Dr. O'Brien, your new pay, you see 25 patients on average is what we're seeing in your schedule right now, and then 7.8 new patients per day. So that's new patients that have never been to an Aspen Dental at all or within a year are coming in as a brand new patient seeing Dr. Turner or Dr. Sendor.
now you said like 30 to 40. That sounds wild, right? For a dental student to hear that number. But Brian, or would you guys want to explain what that number consists of? Because you said, I mean, you're probably seeing some new patients, some returning patients, some denture patients. So, and some you might be seeing for like 2 minutes.
Yeah, so
Yeah.
you got the doctors could probably talk a little bit.
Well, I was gonna say it's like, 30 to 40 is also depending on, do you have the 14-day new patient day or the 4-day new patient day?
Right.
So it's a hard number. It does sound a little scary, but I would say about 5 production patients a day, depending on what kind of production you're doing. And then your overflow, that's a lot of the new patients and like exams for hygiene that you're just going in to check on them. That's not taking a lot of time. Your overflow is not taking much time either. You're going in, you're doing a wax bite or a wax try, you're taking sutures out or something that's don't have to be there.
Yeah, I mean, I would say on average, new patients are around 10 minutes, some 15, some less. I would say, I'd say probably closer 10 to 15 minutes for a new patient. Production, like we said, you get to pick your preferences, and that's all dependent on, if you're doing a full mouth surgery, you might need 2.5 hours, but if you're doing, a couple of like single extractions, we never make anything less than an hour just to give yourself some, room
Time to
work.
leave and go to the new patient or whatever.
Even if it's going to take you 5 minutes to pull tooth, you put it in for an hour and it just gives you some room to work with. Because, with new patients, they don't have their own slots. So, you're breaking away to new patients during your production slots and during your, overflow slots. And, so it's really all about time management and learning to, go numb one patient while you go see another one. And then, things like that, just breaking away.
So one of the
I love
things in my 9 years, my first 3 years was an office manager with Aspen. And one thing that I'm pretty sure they still teach the office managers and the people scheduling to do is A/B scheduling. So your A procedures are those that you're typically a little bit quicker at, and your B scheduling are procedures that you're not so quick at. So we try not to put 2 Bs up to next to each other. So it would always be an A, then an A, or A, then a B, or a B, then an A. Just to make sure that you do have that a little bit of flexibility, like Dr. Ryan was saying, to get out ahead of things and really catch up on the day, if you will.
Awesome. So we have time for one more question, guys. We're going to end it with this one. You guys have been fantastic. So what has been the hardest transition and or adjustment from going from dentist to from going from student to real world dentist? I'll give you guys each a chance to answer that. So the hardest adjustment from going from student to dentist.
I would say it's exactly what Turner was just talking about, which is, time management of when you're going to break away. I feel like it can sound overwhelming, even just, thinking of my 4th year self and thinking 30 patients and breaking away and how that's all going to work. But I really feel like my owner doctor, watching him, they're pros at what they've been doing. So being able to see that and pick up and learn was a lot easier because he was there, but it is still, I think, a process of learning how you're going to handle, and still now, you're still learning how to handle the new patients and give them the care they need by also knowing you have a production that's going on and maybe another patient that you need to be seeing. So not, dental school, you're just with that one patient. So being able to have 3 or 4 or 5 patients at one time and not be overwhelmed. Learning the time management. That's going to be my sum up of my transition.
Yeah, like same with her. It's all about, pace and time management and flow of the office. Once you get in that flow, once you, mentor, you walk around with your mentor, you see some other doctors do it, and, you start getting your speed up and things like that. Once you get in the actual flow of the office, then, that's when you really everything starts to click. In dental school, you're doing a new patient exam takes, 3 hours, and you're doing a million things. Whereas by the time I walk into a new patient, the assistants have already during COVID, gone out to their car to get them. They've taken all their x-rays, their med history is in the computer. The hygienist has been in to probe and come give me her opinion on, their perio diagnosis. And, I walk in with every piece of information I could ever have.
And they've all been scanned.
So I walk in, I have looked at the x-rays, the assistants have told me chief complaints, things like that. And I walk in and go over the x-rays with them, go over the scan with them, look in their mouth, do their clinical exam, and do, talk to them about their treatment plan. And you get the hang of it. It seems scary. I know we say 30 patients a day, and you're like, oh my gosh, 30 patients a day, I see 2 right now. That's because you're doing a lot more, and you're a dental student.
You got a whole team.
You got a whole team here helping you do, a lot of the things that you were doing yourself in dental school.
I love that. Now, really quick, guys, when you say you have a whole team, tell me a little bit about your team. Who do you work with? You have DAs and you have your hygienist. Who's your supporting staff at the office? And then we'll wrap it up.
So we have, I have an office manager who is the one that I'm normally either setting the treatment plans with, and they're sitting down with the patient to go over the treatment plan. I have a PSR, which I don't even know what the acronym is.
Patient Service Representative.
Yeah.
She's the one that's doing a lot of the insurances and calling the patients, rescheduling, all of that.
Front desk, basically.
Yeah,
yes.
Three front desk people, I would say. Or we're about to have 3. Do you have 3?
Yeah, we have 3.
Yeah. And then you have your assistant office manager. And then assistants, 3 assistants.
I have 4
Yes.
because we're two
Yeah.
doctors.
Hygienist, I have 1 in my office, and he's got 1 too. And then our
And
own
a lab
doctor
tech.
and a lab tech. Oh gosh, don't forget her.
Don't forget the lab tech. It's
No,
important.
very important.
Also,
Very important.
there are some offices, like the Lexington office actually has a part-time hygienist. So they have a full-time hygienist and a part-time. So again, depending on your patient volume is really where we dictate for bringing extra hygienists or things like that.
Yeah, and we don't do consults either. I know in school you got to take everything to finances. We do the treatment plan, present it to our treatment coordinators, our office managers, or assistant office managers. They take care of the money part. It's great.
I love that. All right, guys. Well, we're wrapping it up. I want to say thank you so much for joining us. You guys were fantastic, and you answered all the questions that were thrown at you. We didn't get a chance to answer all of them, but if you guys have any specific questions that didn't get a chance to get answered, please don't hesitate to reach out to me or reach out to Brian. The email that went out has all my information. Please don't hesitate. I know if you have already asked about how do we set up an interview or how do we get in touch with you about locations, shadowing, we can talk about all that offline. So don't hesitate to reach out to me. Shadowing, I think, is awesome. You guys, hopefully down the road, we'll get a chance to shadow. If you guys, if any of you D4s are interested in shadowing, I know that Dr. Sadler and Brian, you guys said that, that's an opportunity as well. I know COVID's kind of gotten things a little funky, but hopefully, when things kind of go back to normal, we'll be able to start shadowing. I do also want to mention the CE credits. I know you guys said because of COVID, you guys have done so many CE courses and credits. One of the questions that did pop up was how many CE credits and how much money towards CE do we offer? We have tons of free CE courses. And we're actually offering those now to students. So if any of you guys are interested, we do have an online portal with free CE, and that's free until March 2021 for all of our students, and tons of certifications and courses on there. But again, thank you guys so much for being with me. Anything you want to add, Brian?
Yeah, I was just going to say, to piggyback off the CE thing, we are an ADA cert provider. So all of our CEs are accredited by the ADA as being functional, essentially. So it's not just generic stuff that we put out. It's stuff proctored by an actual person, worthwhile. It can contribute to your licensure and things like that.
Absolutely. But again, guys, thank you so much for being with me. If anybody has any questions, please don't hesitate to reach out. But that's it. That's our time.
If anybody needs to reach out to Danielle or I, you can
can give them our email,
you
or
guys have
just
permission to give them our email,
Instagram. Whatever you need.
and they can ask us any questions.
I love it. So yeah, if any of you guys want to reach out to our docs personally, shoot me a message, and then I will get their emails, phone numbers over to you guys. If that's okay with you guys, your phone number, shoot you a message, creating a network. And then again, if you want to shadow, we can set up those days too. All right. Thank you guys so much for being with me. To all of the folks that attended, you guys are fantastic. You guys had some great questions. And I'll be sending out some follow-up emails with some more information, but that's it.
Perfect.
Thank you, guys.
Thank you guys. See you guys.
Thanks, guys.
Thank you.
Have good luck.
Bye.
Bye. Have a good night.
Good night.